If you're thinking about getting a cosmetic procedure like Botox or lasers or fillers, these are the most common cosmetic mistakes that I see and how to avoid them so that you get the best results and have the best experience. Hey, I'm Dr. Sam Ellis, and I'm a board-certified medical and cosmetic dermatologist in Northern California. I'm here to help you understand your skin and find products that work for you. So if that sounds good, give this video a thumbs up and don't forget to subscribe to the channel. Before I get too much into this video, I want to be really clear that I don't think you have to have cosmetic procedures. It's a very personal choice. But if you are interested in cosmetic procedures, I do think the choice to get them should be an informed one. So this is what I want you to know. I think one of the biggest mistakes I see is not understanding what to expect from the treatment or what kind of results you may receive. And I think one of the bigger reasons for this is not having a good consultation appointment. So for all of my new cosmetic patients, we sit down, we have a consultation, we really look at their face and their concerns, and we talk through it. And really by the end of the consultation, they should not only know what things I may or may not recommend for them, but also what kind of results they can expect from their treatments. I think a lot of people get disappointed by their cosmetic procedures or feel like they did not have an ideal outcome because their expectation wasn't aligned with the person performing the procedure. Another mistake I commonly see is people being impatient. So they're too eager to see results too quickly. And sometimes what that results in is people going from treatment to treatment to treatment and not letting enough time in between to allow those treatments to really settle and get the optimal results. This can lead to things like just being disappointed with your cosmetic procedures, but also overdoing it over time. I think part of this does unfortunately stem from social media. Oftentimes people will post about the aesthetic procedures that they've had done, but you don't really understand the full timeline of when they're seeing their results, any complications they may have had, or any little tweaks that may have been done in between when you initially saw them and their final result. I also feel like sometimes because of social media, you feel like someone only has one procedure and then they see the results. So for example, lip injections. Some people have the right size and shaped lips where they go in and they have one session of lip filler and they end up with their dream results. But the reality is for many patients is that it might take more than one session to get the volume and shape that you want. Another mistake I commonly see is not taking before photos or pictures before you have any cosmetic treatments done. That before photo always serves as a nice benchmark to refer back to ensure that you're not drifting too much away from your original appearance. Because ultimately the goal for most people when they have cosmetic procedures is to enhance and optimize what they already look like, not to look like a different person. And I think we can all think of either a friend or a celebrity who has really changed in appearance over time, and I bet that's not really their goal, but there's this phenomenon in cosmetics called perception drift, where after just a few days of changing your appearance, your new baseline sort of shifts. And so you kind of forget what you used to look like. And that's where people start to look really weird or odd. And I think that's why people shy away from a lot of cosmetic procedures, is because they don't want to look not like themselves or look overdone. So again, having that original photo to reference back to is really important. Another thing that comes up, especially for people who have had many cosmetic procedures over the years, is they may be changing up their cosmetic provider too frequently. Oftentimes when a patient comes to me, I kind of work with them on a plan and we have an idea of what things are going to happen moving forward. But if someone comes to me from another injector, one, I don't know what's already happened. The patient might tell me, oh, they put fillers here and here, but oftentimes that's not the full story. And I don't know exactly where that product has been placed previously. So I much rather prefer to work on my own work rather than try to build upon someone else's. A lot of cosmetic dermatology and surgery does involve this aspect of artistry. And as you can imagine, it's a lot easier to paint an entire mural by yourself than to pick up on someone else's work. That leads me to the next cosmetic mistake that I see, which is bargain hunting. And I think that's also one of the reasons why people tend to change up their cosmetic provider, is because they're looking for a deal. I do understand that cosmetics is not financially accessible to everyone. It is a luxury, but oftentimes places that are really discounting things like Botox or filler or lasers, it's for a reason. It could be that they're not using the right product. It could be because they don't have a sterile setup. It could be because the people injecting you or treating you don't have adequate training. But if the deal seems too good to be true, it probably is. The other thing I will say is if you're looking for a deal or looking to make it affordable, is that sometimes if you cut corners or go somewhere that's a little bit cheaper, you may not get the work done that you're hoping for, and then you have to go to someone to correct it. For example, I feel like everyone has cheated on their hairdresser at least once in their life, where they've gone to someone else either because it's cheaper or more convenient, but At least anytime I've done that, I have been very disappointed. So now I know that I'm going to invest in the services that I receive, but I have consistency and I know that the result I want is the one I'm gonna get. And just one last note about budget, I do know a lot of patients, and I've had patients of my own, go overseas to have medical procedures done. It's known as medical tourism. The problem with that is if you are getting treated in a foreign country, for example, with fillers or Botox or a laser even, and then you're coming back to the United States, you don't have follow-up with the person treating you. And there are completely different medical laws and obligations to the patient that no longer serve you once you come back to the US. Which kind of brings me to my next point, and it's a mistake that unfortunately I see a lot, is getting treatment by someone who does not have adequate training or licensure. And unfortunately, I feel like this is mostly due to a lack of regulation in regards to cosmetics. So for example, you can have someone who is a nurse in the ICU, and they can go to a weekend course and be educated on Botox and fillers, and then they have free reign to inject whomever they want. And for sure, there are some amazing nurse injectors out there who really know what they're doing and have spent tons of hours training and honing their craft, but it can be very hard for a patient to understand who has the appropriate training and who really doesn't. And it's not just about being able to perform the procedures well, it's also being able to take care of complications, because ultimately these are not just cosmetic procedures, they are medical procedures that can have adverse events like skin necrosis, blindness, permanent scarring, and those things need to be taken really seriously, and you need to be under the care of someone who knows how to do the procedure and manage any complications that may arise. I think one of the easiest ways to avoid this mistake is to vet your injector or your surgeon. You can look up their credentials, where they trained, how long they've been out of training for, if they do any teaching or are involved with other types of education. Also, sometimes injectors will post their before and afters, and that can give you a sense of what they're capable of. But I always remind people that you have to be a little bit wary of before and afters. People are always posting their best work, and unfortunately, there's a lot of retouching that goes on too. I think one of the best ways to find a good cosmetic provider is word of mouth. Sometimes though, really good work is actually undetectable, but if you have a really good friend and you know they're having a little bit of a glow up, hopefully they'll share their cosmetic provider with you too. Another thing you don't want to do is get treated somewhere where they only offer one or two types of treatments. So for example, if you're being seen for a cosmetic consultation and the only thing they have in their office is Botox and fillers, that's the only thing they're going to serve up to you as options to be done. Now, I'm not saying where you get treated, you need to have 100 different devices, but I do think it's important to have multiple modalities to address the skin and the aging face so that the patient gets the treatment they deserve. Another issue people may run into in cosmetics is trying to push their cosmetic provider to do a treatment that really doesn't suit them or that the cosmetic provider doesn't feel comfortable doing. For example, a patient may come in asking for a liquid nose job, but what they don't realize is that it might not suit their face to have that done because it may in fact make their nose look larger. Or what happens a lot in my practice is someone has been getting filler for many years and they're just used to their face that way, and they come in asking for more fillers in their cheeks or more fillers in their lips, and I tell them no because I think it's going to distort them. But what I also recognize is that patient will probably be able to find a cosmetic provider out there somewhere who will say yes to what they're asking for. But ultimately, the happiest patients and really the ones who have the best cosmetic outcomes are those that have a good relationship with their cosmetic provider and who trust their expertise. That being said, I'm never going to force a cosmetic procedure on someone or completely refuse them outright, but my goal is to help guide them and educate them so that they understand what really is right for them in the moment, but also right for them long term. Another thing I see, especially as a cosmetic dermatologist, is people relying exclusively on non-invasive cosmetic treatments. And I understand why people will come to me initially for a consultation. They think a little bit of filler or Botox or laser is going to treat something like significant jowling or significant sagging in their neck. And oftentimes what I have to teach them is that there are limitations to what non-invasive procedures can do. And ultimately, sometimes we need to involve a surgeon or a surgical intervention to get them the results they're hoping for. And again, I'm not pushing my patients to have surgery. To me, it's about educating them on what's going to help them achieve the results that they want. And ultimately, a satisfied patient is one who has proper expectations of what's achievable with different types of interventions. Which sort of brings me to the next mistake that I often see which is people starting too late with their non-invasive cosmetic procedures. And I know that sounds kind of harsh, but really what I'm getting at here is when you start cosmetic treatments a little bit earlier on in life, maybe in your 30s or 40s, where you're just starting to see those early changes that you want to intervene upon, we can get away with doing a lot less and achieving a lot more. So for example, if you're coming in your late 60s 60s or 70s and you have significant jowling or sagging in your face, trying to use fillers at that point will never look natural. I think the people who look the most natural with their cosmetic treatments are people who are doing just a little bit, maybe a couple times a year, and that consistency and slow change and even prevention over time really helps them age naturally and gracefully, but optimally as well. Speaking of being preventative, another mistake people may make is that they rely on these non-invasive cosmetic procedures too much and they're not doing the maintenance work like the good consistent skincare, including cleansing and moisturizing and sun protection in between those treatments. The same way you don't go to the dentist twice a year but not brush your teeth in between, you shouldn't really be going in for cosmetic treatments but not taking care of your skin all the time. Something that can also come up with cosmetic treatments is not being able to have adequate follow-up with the person who performed your treatment. So I touched on this a little bit earlier when I talked about going to a foreign country to have work done, but this also happens within the US all the time, where even I have patients who fly in to see me, but the important thing is that they would be okay coming back in 2 weeks if I wanted to see them in follow-up. And if you're traveling far to see any type of doctor or for any type of cosmetic procedure, you should understand that they want to see your follow-up and you should be able to go back to them so they can intervene if needed or just make some small tweaks. Now, I know I talked about not waiting until it's too late to have cosmetic procedures done, but you also don't want to rush into a treatment if you don't feel ready. And that's a mistake that I see some people make, and then they regret that decision. Even if the work itself is really nice, if they weren't mentally ready to change something or augment something, then it's not the right time or the right procedure for them. So ultimately, it does take a little bit of inner work to know what you really want. And I think it's also important that you don't feel pressured to have a cosmetic procedure done by the person performing it. And the final mistake that I commonly see is not having a long-term plan. We will always be aging. Our faces will always be changing to some degree. And I think it's really important to have a plan of how you're going to maintain or optimize your results over time and moving forward. That could be as simple as coming in every 4 months for Botox, or it could be a little bit more complex, like coming in for Botox 3 times a year and coming in for a light laser procedure every couple of years. But the thing I really stress with my patients is that I want to have an ongoing relationship with them. I want to consistently see them back. And it doesn't mean that every single time they come in, they have to sign up for a procedure or need to have something done, but it's really nice to touch base with them, to see what their goals are, to see how their face looks, and to make little tweaks if necessary, and to continue to plan ahead for what's to come. And ultimately, eventually, non-invasive cosmetic procedures may not be enough to help you reach your goals. And that, again, is where it's really important to have a long-term plan, as well as a really good relationship with whoever's doing your cosmetics, because they should have the integrity and the knowledge to know when to refer you to get the results that you want. Do you have any questions about cosmetic procedures? Definitely leave them in the comments below. Thank you so much for watching. Don't forget to like this video and subscribe to the channel, and I'll see you next time.